Hello everyone, my name is Ville Sallinen and I'm the editor-in-chief of BGS Open. It is my pleasure to tell you about how to write introduction and discussion. So first of all, how to become a good writer. It is to read, and then to write. And if English is not your native language, you need to read and read in English. I mean, you can read anything, but also scientific papers to get familiarized how the scientific papers are written. The blank page syndrome, I think, is quite common. You don't know where to start. I think Martin touched this with you just start writing somewhere, but I'm introducing you to a modular approach to introduction and discussion with paradigms borrowed from screenwriting. So I'm introducing you a three-act structure, which was actually from Screenplay by Sid Field in his 79 book called Screenplay, The Foundations of Screenwriting. So the basis of screenwriting is that you divide the movie into three acts. The act one is the setup, the act two is the confrontation, and the act three is the resolution. And I will tell you how you can make a three-act structure of introduction. So the setup will be the first part or the first paragraph where you shortly introduce relevant background for your study and you give the reader the context to your research. The confrontation is that you tell the reader what is the problem or the unknown on the subject you're studying, and then you will introduce missing piece in the literature. And the act three, the resolution, is that you tell how you're going to solve the problem, which is equals aims of the study. So here in the setup act, the goal is to warm up the reader. You start with appropriate levels of detail, and this depends on the journal and the topic of your study. So, for example, if you're writing to a pancreas-specific journal, where all the manuscripts published there are on pancreas, you don't start with pancreas is an endo and exocrine organ located in the retroperitoneum, because all the readers already know that. However, if you're writing to a general medical journal and you're writing about a rare event or a rare disease, then it's okay to define that in the beginning, so to familiarize the reader. For example, a Schenker's diverticulum is a protrusion of the mucosal and submucosal layers of the posterior pharyngeal wall. So it's all about the audience where you are writing this. And BGS is publishing these brief reports with very limited words. So in those cases, you might want to skip the first act and directly start from the act two, which is the confrontation. So the goal here is to walk your reader through the topic and make the knowledge gap and the problem visible there. So before writing, you want to know exactly the literature you are going to refer to. You have to know exactly what are the most important studies in that field, and maybe even more importantly, you need to know what are unknown in that field, or what is a clinical problem without a solution. So you will tune this act so that your study will answer the unknown you are going to present here, or find a solution to the problem you are going to mention here. So you want to avoid exhaustive literature review here. You keep it short, just focus on the problem, focus on the unknown, and discussion section is then placed for broader discussion. And you don't want to introduce any unknowns or any gaps that you are not going to answer in your study. Then the third part of the introduction is the resolution. So here you answer that question that actually this study is going to find out or find a solution to that problem I just introduced. So you're gonna give a short preview. What are you gonna do? You're not gonna go into the methods in detail. That's the methods section. But you're gonna say that for example, we carried out a randomized controlled trial comparing X to Y. And the proportions of these three acts, these are of course, it doesn't have to be accurate, but at 1/4 should be the setup, half should be the confrontation, and 1/4 should be the resolution, roughly. If we move to the discussion, we can actually use the same structure for discussion. So the setup, confrontation, and resolution. So here in discussion, the setup is that you summarize the key findings of your study. Not every detail, just the main findings of your study, quite shortly. The confrontation here is that you discuss your findings in the context of the current literature. And the resolution here is that you will tell the reader how this study should affect clinical practice, should something be changed, or what would be the next step in the research. And here actually 3 steps is not enough, because as in the movies, when you have killed the monster, it will rise once again and come back. So here you have the 4th act, the monster comeback, which is the limitations of your study. So the act 1 of discussion setup, goal here is that the reader can read just this paragraph or just this part of your whole article and get the main points. This is actually the most read part of your manuscript after the abstract. So use plain language to summarize your findings. You want to avoid exhaustive abbreviations so that you don't need to have a manual to see all those what you are talking about. And you want to make sure that this part is understandable on its own, so that you don't have to go to the methods, you don't have to go to the introduction or results, that you can just read this paragraph and understand what this study is about. And this serves as a basis for the next act, the confrontation with other studies. So don't repeat aims here, don't repeat methods, and don't repeat what you have already said in the introduction. And also, just like in the introduction, if you're writing a brief report with very limited word count, you may want to skip this act. So then the act 2 of discussion, the confrontation. So you confront with your study results the other studies. So here the goal is to compare your study to existing ones and show how this study extends or changes knowledge relative to them. If your study, if you're struggling to write this part, your study does not create any new knowledge, then maybe you should consider going back to the drawing board and then design a study that will, create new knowledge. Again here, don't repeat the introduction. You touched kind of the base of the small literature review in the introduction, but you can go deeper here. But avoid it to be exhaustive. I mean, include only the ones that are relevant in the context of your study, not in the context of the whole field or the whole, the disease, for example. And sometimes the referees will want you to include, you should include more discussion on this very tiny detailed results that you have or this tiny finding. It's usually better to, do as the referees say, but you should avoid mentioning and speculating every minor detail that you have in your study. Otherwise it will be exhaustive. So stick to the main findings of your study here. And then Act 3 of the discussion, resolution. Here you will tell the reader what the study means for clinical practice or for research. And here you should be specific and detailed. It's useless to say that this study helps clinicians in helping patients with X disease. You want to explain in detail how it will improve or how you think the patient care should be changed. And also more research for X is needed. I mean, that's just a general sentence that we always delete. Be more specific. What kind of research? Is the next step a randomized trial? If it is a randomized trial, what should be compared there and which kind of patients should be included there? Be specific, but be cautious here. Do not overinterpret your results. I mean, if you have a small retrospective study, that rarely changes policies, but if you do a large RCT, that might actually do that. And then one of the most important act or part of discussion is the monster comeback, the limitations. And this needs to be in every manuscript you ever write. There always has to be a limitations section. So the goal is here to describe what limits the conclusions that you have made from just from your study. And you have to be honest and you have to be inclusive. There are always limitations, no matter how good your study is. And don't try to hide them. The referees, the editors will find out. And if you haven't stated them, they get angry or ask you to include those there. But here you can explain how you have tried to overcome these limitations that you will have in your study. And you may also state some of the strengths of your study there. And the shares of these acts, I would say roughly again, 20% in the setup, 40% in the confrontation, 20% in the resolution, and then maybe 20% in the limitations chapter. So this was the modular approach to introduction and discussion. If you think of these parts, then it might be easier for you to write these sections, and you don't have to write them 1, 2, 3, 4. You can start with, for example, number 2, and just write that part of the introduction first, and then go to the first part. And this just as a general advice to everything in life, but also for introduction and discussion. This is the famous Albert Einstein quote that everything should be made as simple as possible, but not simpler. All right, thank you. And if you have any questions, I'm happy to answer.